Okay. Facial paralysis and Bell's palsy, pattern differentiation in TCM. What is the main pattern here? Wind, right? This can be internal or external, right? In the case of Bell's palsy, it's often external, acute onset, right? External patterns, and here's a summary, again, I know you will get these later, but external patterns, of course, as usual, we will separate them, differentiate into a yin or yang type, a heat or cold type, all right? Most of the points here, most of these differential points are based on the manifestation. So with facial paralysis, we choose points based on what part of the face is experiencing that paralysis, and we modify the points accordingly, right? It's not very difficult. That's just, what most of you have expressed that you have knowledge in, which is, local needling, basically. If they have difficulty with the mouth, we choose stomach 4, these stomach points around this area. If they're having eye problems, you're going to choose points around the eyes, etc., etc. All right, there's not a whole lot in that differential part. Generally, sudden onset and generally on one side of the face instead of two is a clinical differentiation. And there's some other things that you can do there to test it when it's more subtle. Often I find that in China, patients all the time come in for this with full-fledged, prolapse, Bell's palsy, or stroke. To treat this, often we may not see that extreme, so we may just have a little bit, on one side. Generally, TCM is a secondary route for treatment rather than primary. So we often see, what you see in the textbook as the signs and symptoms. The patient, might have some of them, or not quite as severe as what the textbooks often list when they're, pulling from Chinese trials or, classics. Also in, classically, all of the traditional texts, this was the only treatment method used. Okay, I'm going to stop talking and go to the content. So the affected side, key signs and symptoms: weakness, there may be numbness, tingling, paralysis, disappearance of wrinkles, smile lines, I think is what that means, this kind of thing. Enlarged rima oculi. Anybody know what that is? The rima oculi? Is it this part of the eye? Ocu is the eye. What was a rima? I'm pretty sure it's this part of the eye. Right? Yeah. So it's this drooping. Yeah, drooping. Exposure of the sclera. With the underside of the eye drooping, lacrimation, because you can't close your eyes aren't. Your tear ducts aren't working correctly. Flattened nasolabial groove, again on one side, that droop. This is all just drooping. Drooping mouth angle, deviation to the healthy side. Affected side is unable to frown, raise the eyebrow, to close the eyes, to show the teeth, to expand the cheeks. So, we will often do these kinds of tests. So we, tell the patient to, or frown or raise the eyes, kind of thing. All right, to see what area, because we don't want to do all the points on the face. So we want to kind of figure out what part of the face is most affected, so that we can focus the treatment there a little bit, right? Related to the nerves. For some patients, there may be pain behind the ear, hyperacusia, sensitivity to sound, right? Hyperacusia, sound, right? Sensitivity to sound. Taste deficiency in the front, 2/3 of the inside. Right. No, I don't know what that is. pathogenesis, remember, does all the yang meridians go to the head and face? So generally we're going to treat yang meridians more so than yin, especially when it's an acute onset. Now, there are deficient chronic complications or patterns which can complicate this, but largely we're still going to use these yang channels on the face, mostly stomach, large intestine. I want to say most of the points are stomach points. I mean, there are some of these up here that we will use, but we generally don't think of the urinary bladder and gallbladder as much. Sanjiao, yeah. We, I mean, all the points on the face we can use. But when we're talking about those 4 points that are, when we're talking about like distal points, they're usually to affect the face, right? We're looking at yang ming, stomach, large intestine, similar to the sinus congestion.
There are some main nerve coming in those areas of this.
That's right. Yeah. Okay. We already went through this, didn't we? Okay, wind cold. Again, wind cold, sudden onset means exterior wind. Light colored tongue or white thin tongue coating, floating and tight pulse is the signature pulse for exterior wind cold. Tight pulse usually means cold. Floating because it's exterior. History of onset, I think what it means here is onset related to exposure to wind and cold. Okay, I was walking out and blah blah blah. Wind heat, again acute, usually with heat signs and symptoms, fever, dry throat, red tongue, thin yellow coating, floating and rapid as opposed to floating and cold. Clear? Okay, basic. See the recurring themes? Good. If there's a qi and blood deficiency, usually this will be chronic, the chronic stage. So somebody may have an acute onset, but they're actually coming to you saying, in 1997, I had acute onset of this, and now it's 2015, and I still have these problems with it. Chances are there's a deficiency present. Okay. Low energy, pale complexion. There may be vertigo, usually with the dizziness, with the blood deficiency. Pale tongue, white coating, thready pulse indicates the blood deficiency. Weak pulse because of the qi deficiency. All right. Major points. Okay, the Yang Bai GB41 is especially for the eye. The eye is affected.
Is that 41 or 14?
Oh, 14. Sorry, you're right. 14. Right? 14. Yeah. And also, it has the ability to kind of lift qi in the face. Right? It's like it's the highest point in the face, so has some lifting ability. See stomach 2. All right. Stomach 2 is for the major point under the eye or the underside of the eye. Taiyang. Okay. Stomach 6. Okay, the TMJ point, right? No, stomach 7. Sorry, stomach 6 is on the masseter and masseter. Yeah. So we often stomach 4 we often do. Sometimes you'll see stomach 4 threaded through and through to stomach 6. Hugu, Li4, because face, Yangming, moves qi, expels wind. Liver 3, why? Yeah. It is 4 gates, but because of the wind component, even though it's exterior, often, liver 3 will be included because of the propensity for we were talking about like tinnitus. It's like, well, yeah, it may be onset or 99% due to a certain pattern, the exterior wind in this case, but it's likely that the patient has an underlying propensity to liver condition, internal wind as well. It depends. I mean, that's like the point selection specifically, you know, this would be perfectly appropriate. Stomach 6 is used a lot when it's this part, right? They try to fill their cheeks up. Okay, so the TMJ, even though it's a strong point, and its effect comes up this way a little bit more, right? The upper part of the trigeminal, this, I don't know how to describe. I mean, really, what you're trying to do is tonify these muscles here, right? So this point is really in the muscle more, rather than the joint and the nerve here. I mean, I'm not saying I like big needles, not big needles, but big needle technique, meaning I would probably do both. I wouldn't hesitate to use them in clinical practice, but the point differentiation has a lot to do with where the paralysis is.
You say that the problem is a muscle, then you do acupuncture on a muscle. What extent this is right?
Well, I mean, every acupuncture point has a local effect. So if the problem is in a muscle, 9 times out of 10, we're going to do the point in that muscle if there is one. And sometimes we use the non-traditional points in the muscle. Yeah, Asha point or whatever. That said, let's see, how do I answer that question? I mean, that said, there's also more to it than that. I mean, there's the pattern differentiation has to be taken into effect.
Yeah, what I meant by that's not local point or Asha point. I meant, for instance, for neck stiffness, I read somewhere,
if it's cervical,
you acupuncture these 2 points instead of the 4, because this is more muscle here, and this is muscular in nature, so these 2 connect.
Yeah, so you know that's a specific system. In terms of like TCM theory and diagnosis, there would be some truth, like where the question is rooted is the idea of, you know, the spleen and stomach and yangming are, you know, the spleen governs the muscles. If it's kind of a systemic muscle problem, right, then we would look at that system. In needling technique, when the problem is in the bone, we go to the bone level, and we often choose points that go to the bone. So some points are in muscles, like this one, and some points are in bones. And when we say in bones, we really mean in a joint cavity, so we can get the needle to the depth of the bone, but it's usually in a joint. So, I don't know if that maybe answers your question. Like, I may choose points in muscles versus deeper point, like in the knee, or another example, you know, where I'll change the point based on where it is, where the pain is, and or what's causing it.
We can see, for example, the lung changes, the other medium part of the lung.
Yeah. You're right. So lung, large intestine, you're talking Zhang-Fu, kind of internal, external pair. Yeah, we can. From my perspective, it doesn't mean that it's better. There's reasons for doing it, but it's usually the exception. I mean, the first thing I think about is the affected channel. The qi propagation goes along the meridian. So when I have neck pain, if it's posterior, I think of small intestine and urinary bladder. If it's lateral, I think of Sanjiao, gallbladder. You know, like those are my first priorities. These are the exceptions, or these are the kind of rarer cases when usually when other things are present. Or you know, if you're using like the TAN method or something like that, it's a specific. Or what's the TAN balance method, or what else is the Tong style? You know, there's a whole different theory around that. They have rationales, but it's not the first thing we want to think about. Yeah. Yeah, that's right. I mean, in the States, there's a 5-element school. I don't know how familiar, but the 5-element school, I think Thai Sophia Institute or whatever in Maryland. And I tutored so many students from there because they learn J.R. Worsley and Lonnie Jarrett's material, which is really interesting and great, but they don't know anything about TCM or pattern differentiation because their whole mind is wrapped around that way of doing things. And so most standardized exams focus on that. You really have to make sure that you're square on those basic knowledges. Yeah. All right. So where did we leave off? Okay. So function clears wind. Any of the exterior, whether it's wind heat or wind cold, we can use GB20. Li11 for wind heat. All right. Clears heat and wind from the exterior. Stomach 36 for a deficiency. Again, that idea of tonifying the Yangming area, and stomach 36, of course, tonifies. And then this group of basically local points. So if you're given a case and it was Bell's palsy and it's specified that they had this, problem in this area in the mouth region, right? And add some local points to your overall, choose your points that you're going to use locally based on how the symptom is manifesting. Simple. All right. Explanation. Is there anything we need to go through here? Remember, all points will dredge. The basic idea here is that usually when there's exterior wind, the channels become obstructed, and then the chi and blood do not flow through the channels once it becomes obstructed. So the treatment principle is to dredge open the channels, and some of the distal points will have that function. All the local points will also have that function. You're trying to increase chi and blood circulation to get those muscles working again, right? Yeah, Li4, right? Li4, liver 3 to dredge the channels distally with reducing. Stomach 36, if there's a deficiency, tonify. All right. You may want to think about when you're writing your answers indicating whether you're tonifying or reducing a point, right? We often go through, the very basic idea is, well, what do you want that point to do? Are you trying to get out stagnation, or are you trying to bring chi and blood to that point? If it's a deficient condition, you're probably tonifying. If it's an excess condition, you're reducing, right? So when you're writing your answers, you can indicate that idea. And I don't see it listed here much in the treatments, but moxa is always an option as well. It's in the chi and blood deficiency. I would probably write down moxa stomach 36. It's a good treatment. It's nourishing, it's tonifying, or needle and moxa for that matter, right?
And in case of for example, all of the points they reduce.
Let's just go. Okay, so most of the time. Sorry, let me just find where was this is the group of points, right? Yeah. Most of the time, actually, in the prolapse side, we're trying to tonify. Usually we're trying to tonify in the local area. Remember, the chi in the blood is not moving here. We want to dredge the channel, which is the distal points, right? Because we want to clear. But to be honest, we don't often do much manipulation on the face because there's a it's a great risk. There's a lot of risk. But when I was in China, absolutely they did. And mostly they're tonifying the prolapse side of the face. Most of the time. Yeah.
When you use electrical stimulation, is it always stimulating, or can be, depending on the point, can be reducing?
E-stim is not very specific. I mean, I've seen some research about changing the wavelength and having different effects. You know, so it depends a little bit, like the wavelength and the intensity. Generally,
Polarity.
What's that?
Changing polarity from positive to negative.
I'm not sure that the effect of reducing is going to be a stronger and more dispersing stimulation. So a higher amplitude and more like stronger stimulation is generally dispersing in nature. Where if you have like a lower and smoother stimulation or smoother wave stimulation, could be a little bit nourishing. Yeah. Okay. So did I skip a section? No, right? Alternate treatment methods. We can use tapping, right, with the hammer even. Okay. We can use pricking, bloodletting, and cupping. So bloodletting, GB14 can be done. All these points on the face, and then cupping. You know, one of the treatment methods that they use in China is direct moxa and also cupping on the face for these conditions. Again, you have to be careful about how you do it. So if you're doing moxa, you cover the eyes and you make sure the hair is protected, and it's a very quick movement. You can't leave it in any one place too long. And then the very small cups can be used in certain areas. I mean, you don't want to go over the artery here, but you can use it on the jaw and you can use it on the forehead. So usually in moving cupping, they don't actually retain them. It's kind of sliding cupping. So they can be used. Yeah. Some extra points. External points kind of for external application. Okay. Okay, so this is topical herbs, ma qianzi, placed over fabric on the point. All right, and small amounts of shi xian. Okay, the musk. Shi xian. Okay. Right. Yeah, we can't. You can get what we call manufactured version though, right? It's not the real stuff, but the manufactured you can get. It's not as good, but okay. Bing Pian is a good alternative, right?
The golden time for the treatment is before 3 months, right? But then after 3 months of the pregnancy. The sooner is better, right?
Sooner the better. Yeah, absolutely. Bell's palsy or, definitely the sooner is better. And this is also where we generally look at acute versus chronic, you know, like after 3 months, you're almost considering it a chronic, moving into that chronic deficiency type pattern. Okay. So acupuncture is the first choice in China. Even if you go to the Western hospital, if you have a stroke, you have facial paralysis, the first thing that they recommend is acupuncture. It's one of those, real strengths. It has much, it's better than what most Western medicine can do. So, acupuncture is the main treatment here, and it's done regularly, and that stimulation usually creates change within that, short period of time. Yes.
For face paralysis, to do alternation on the treatment, like one day on the affected side, and then the next day on the.
So one of the theories around treating the unaffected side is that if you don't have enough qi in blood, the acupuncture doesn't do as much. So I've read this, but I've not in clinical practice. I almost always see the affected side being treated. But theoretically, when there's not enough qi in blood here, we can treat the unaffected side because you'll get more sensation, more stimulation at the points. I'm not, but most of the time I don't see that done in clinical practice. I rarely see it done in clinical practice. If a patient is coming every day, however, for treatment, I would see that it's probably, so if you needle the same point every day, day after day after day after, it gets numb and it stops having an effect. So I would say that none of my patients come every day. Can't get a patient to do that. They can't afford it. They don't have time, right? So, I've never had to deal with that question, but if they were, I could see why you would do that. Alternate between the affected and unaffected side.
You only do the two sides, never do one.
It depends. Yeah, I don't always do both sides equally. I mean, another treatment print. I'm trying not to confuse you by giving you a lot more than what's in the notes because I'm trying to keep it narrow enough to digest. But when you do treat both sides, sometimes we do reducing and tonifying one side and then opposite to the other side. Right? To try to basically go like that with the face, right? Like lift one side and calm and relax the other side because, the other side builds up all this tension, just like walking with a limp. It's like one side of the body gets all jammed up. So I don't know if that's, that would be another method of treatment. Here's your e-stim information here. Initially, and also when it's acute and in the initial stages, it's also often painful and uncomfortable. So it says to use more, gentler manipulation, and then prolong with atrophy. Then we can, this when we want to use more stimulation and e-stim, right? Stronger stimulation to get those muscles firing. The prognosis is closely related to how much damage there is to the facial nerve. If it's from aseptic inflammation, there's a good prognosis. If there's a virus that has damaged the nerve, it may have poor prognosis, or if there's other types of nerve damage, nerves don't repair very well. We all know that, right? Yeah. So as soon as there's like damage to the nerves, it's difficult to create substantial change. I know we don't have this stipulation in the Ontario legislation, but certain other jurisdictions stipulate that if the patient does not improve after 6 months of regular treatment, then you are supposed to discontinue or send them somewhere else. We don't have that stipulation on us yet, but if you continue to treat a patient, twice a week for 3 months and you don't have measurable improvement, don't keep, pushing in that, like have them look at other options. So during the treatment period, health maintenance, keep the wind off of the face. Canada, cold, hello. Okay. And if you can't, if they can't close their eyes, then you can put eye drops in the eye, maintenance. Yeah. Qian, Zhen, Tang. Qian, Zhen. Zhen, Zhen. Zhen, Qian, Zhen. Okay. So if you look at the formula here, it's a little bit of tonifying here. There's a decent amount of exterior wind, right? Venting the wind from the exterior. Chuan xie, right? This is a scorpion. It courses open the channels. It's used for more extreme conditions, stroke and paralysis mostly, right? Fang feng, it clears exterior wind, but it's also a major herb for any of these wind conditions. Xianlin pi zao jiao. Not sure why they're using this here. Chuan zhong, go teng, huang qi. Huang qi raises up to the head and face. Go teng is more for interior wind. Gugen clears exterior wind cold. And then there's, Honghua and, where is it, Chuanzhong. These, we want to move the blood a little bit because there is a certain amount of poor circulation of qi and blood. Clear? Great. Okay, moving on. Next one. Do you guys need a break? Good. Let's close that one. What's the next section? Is eczema. Okay. All right, so that actually, now we get into the dermatology section. I think that actually concludes, the sense organs. And this is skin dermatology, Waike section. Before we jump into this section as a whole, so when I teach the intro to dermatology, just remember there's a number of factors that arise in the surface. We're talking not just dermatology, but really all diseases that manifest on the surface of the body. So we separate in TCM to Waike, Nika. Nika means organ function. Waike means manifestation on the exterior. And in the old days, traumatology, ears, eyes, nose, throat, dermatology, these were all grouped together as external in nature. They were all attacking, which basically means a disease manifesting on the meridians, right? Which includes the body, the surface of the body. As opposed to Nika, which is the functions of the organs, cough, kidney problem, the organ functions. So just keep that in mind as a broad bit. Now, eczema. Eczema is what are most skin conditions? What is eczema specifically? Eczema is wind. There are many different types of wind in TCM. There is exterior wind, which is colds and flus. There is interior wind, which is related to, paralysis and stroke. Wind stroke is really, I'd say, related to internal wind, but almost its own category. And then, the internal wind, which would be like tremors, shaking, old age shakes, tics, movements, dizziness, all of this is a form of interior wind stirring. There's also B syndrome, which we can often think of as a type of wind. It is wind and dampness moving through the joints. So there's many types of wind, and not all the skin conditions, but eczema is a type of wind. It almost always involves itching, right? Irritation, some itching. And the reason, in TCM theory also, because most people get it in one area, and then, maybe days, maybe months later, they get it in another area. It moves around. That's the nature of wind. All right. Wind also brings it to the surface. Okay. So part of the reason it comes up, and when we treat it, we use a lot of the same points. That's actually why I'm going through that. The herbs that release wind heat and wind cold from the exterior of the body are also the same group of herbs that we commonly use in dermatological conditions. And the points, not all of them, but a lot of the similar points that would be used for wind, external wind can also be used, right? Keep that in mind. Now, so point being, do 20, all right, can be used for, now, I'm a little confused here because it says Da Zui, which is do 14. All right, so I'm assuming that this is incorrect because normally we would use do 14, not do 20. All right, do 14. Why? Because, what's that? Okay. Right? Why? Because this is the intersecting point for all the yang meridians, and often, we want to activate or have some effect on all the yang meridians in the body, which cover the majority of the surface area, we would choose that point. It's also especially useful for exterior wind, you know, if it's acute eczema, kind of mild, dry, itchy, and heat type. It's a major point. LI11, in the textbook, like dermatology textbook, almost always, right? LI11, DO14, for any heat type of eczema, and they're indeed the most kind of major points here. Stomach 36, mostly when there's a deficiency present. We don't use that all the time. Spleen 6, we mostly use when there is some blood deficiency or yin deficiency underlying it. And heart 7, mostly when there's agitation. So it does clear a little heat from the heart, and in certain types of eczema, there might be more agitation and blood involvement with the blood deficiency. We can use heart 7. So major types of eczema, if you think about diagnosis and pattern differentiation, if there's a lot of fluid discharge, right, exudation, you consider it damp heat primarily, right? So there's how do we say, there is damp heat predominance. Usually that is the cause of the eczema. If that's the case, then we will, let's have a little more room here, almost always use spleen 9. We can do 13 or 14. I mean, usually we don't do both, but one or the other. Lung Shu points. I would add that sometimes we use gallbladder 34 if there's any sign of like middle jiao damp heat. You know, spleen 9 is probably more empirical though. All right. Formulas: Qingre Chu Shi Tang and Shuling Chu Shi Tang. And it's basically clearing damp heat from the interior with a little bit of effect on the exterior. What is pruritus?
Itching.
Okay, so if we have severe itching, it means that there's wind predominance. So your additional points should focus a little bit on clearing the wind. Actually here, looking at the points, they're looking more at the blood right now. So specifically PC4 and spleen 10 have a stronger action on clearing heat from the blood, which is not what I think of. It's not the first thing that I think of with severe pruritus, but it is true that blood heat can also agitate or stir wind. But the symptom of severe itching, it means that there's wind predominance. Let me just do what else is written here. Okay, so let me just go, I know that these are this is a basic differentiation, but let me also say that there's deficiency, all right? So who said earlier, dryness of the skin, right? Dry eczema, blood deficiency, right? The nature of this type of eczema there would be no discharge and not much redness. It's just kind of like very dry, quite irritated skin with systemic signs and symptoms of blood deficiency. Pale, it's usually chronic, et cetera, all right? There is also blood heat, which this is really kind of, tying into blood heat, the points here that are listed, which heat enters the blood. Heat can do two things. Well, does multiple things. Once the heat gets into the blood, it causes rampant movement. We often have bleeding. We often have skin problems that are bleeding in nature. So, sometimes when people itch, you see like bleeding, right? Differentiate a little bit, if you physically damage the skin so bad that you have bleeding versus like, I just itched a little bit and you see all these spots of blood. Very likely that there's some blood heat involved. Heat will also, what we say, dry up the blood. So in either case, when there's blood heat, I would think about adding spleen 10 and UB17, which is not listed here, and pericardium points for actually, most of the pericardium points have an ability to cool blood. Okay. Yang Shui Chu Feng, right? Tonify the blood, something wind decoction. Huang Bai, Bai Butang, and Shi Zhen Xun Yao Feng. And I'm not even familiar with that formula. I'm also going to mention, so from a Western perspective, there's often a food relationship, all right? TCM, that usually ties into like a damp heat kind of thing, but it could trigger any pattern could be triggered by dietary responses. Also be mindful of external irritants commonly aggravate eczema. So, looking at soaps and, body soap and also laundry soaps and hard water and all of these kinds of things. All right. Okay. I think this is supposed to read, it is an effective treatment method to treat this eczema, not enema. Right? Okay, just so we're clear on that. It can relieve symptoms, but it is difficult to cure it. Okay. Immune cause. Okay. So damp heat, again, I'm going to focus on the pattern differentiation. Damp heat and chronic is usually acute damp heat or exterior chronic blood deficiency pattern. Papula, blister, Blaine, okay, effusion, scab, serried punctiform erythema, papula, and papulovesicle-like grain appearing in the beginning. Get to phlysis, punctiform anabrosis forms after diabrosis. Ooh, this is thick here. Yeah, this is right out of like a dermatology definition textbook. Yeah. Okay. So really, what this is trying to describe is I think, is the Western, differentiation of eczema here, as opposed to like psoriasis or other patterns. Okay. Usually it's, yeah. You guys want me to go through this?
No.
I can. Okay. I mean, when I teach this course, I actually focus on the differentiation between psoriasis and eczema, because those are the two that are more commonly, there's a lot of gray areas there. Major differences are that psoriasis is often on the joints, right? What do you call it? Not dorsal, the outside of the joints. That's the word I'm looking for. Extends. What's that? Sometimes, but not always. Sometimes, but not always. There's usually a much clearer border, and then we have the big, the scaling, the silver scaling is a major one, and then it tends not to move around, so it tends to, stay in one area for a long time, where eczema usually is people will get it here and then here and then here. Eczema has varying degrees of severity too. So eczema tends to have more of the yellow serous fluid discharge as well. You know, bulla, the bulla will come with that. Okay. Neurodermatitis, right? Neurodermatitis is neurological damage to the skin from neurological problems, right? You're itching, you're somebody who's like that. And, you know, the nature of dermatological conditions is once you damage the skin, this condition festers because the skin is damaged, the chi, blood, and body fluids don't continue to go. So anyways, besides the point.
The eczema is the disease in the tissue.
Right.
But psoriasis is not. Psoriasis is not. Then when we diagnose this before we have a patient with this diagnosis of the psoriasis, to categorize it in the TCM as a eczema.
Well, I mean, the words are different. The words are different. So if it was me, I would not take it and say this is eczema, right? But your pattern differentiation and diagnosis is basically very similar. There's no real difference in how we treat it for the most part. I mean, there at a more advanced level there is, but
as an example, I said that in the exam, when we have this case.
If you're sure that it's psoriasis, I would write psoriasis. I mean, in the first year, you know, we told people like, oh, you know, just stick to what these diseases that are listed are. But, you know, if they give you clear diagnostic, a differentiation where you're sure that it's psoriasis and not eczema, I don't see any reason it would make any sense to write eczema instead, because eczema is a Western definition. We're just, you know, we're translating a Chinese term and it's translating over like that.
But they put it in the shoe as a Chinese disease.
Right. That's what I'm saying. I mean, but all of those lists, so they're all from the textbook, which is Chinese language, right? So that term, which we are translating as eczema, in modern terms, it means eczema, is more encompassing. But my point being is if you flip it around and you say, well, psoriasis is the better English definition of that disease, then I think that would be appropriate. You just have to be cautious not to make a clinical Western diagnosis. I mean, that's what is beyond our scope of practice. But if if they're giving you that differential, I see nothing wrong with that. All right, so this, didn't we already do this? I thought we already did this. This is, or it's just listed in the summary, but ahead of time. Okay? Okay, hard 7 for calming the spirit and alleviating itching. So this is what I said, often with eczema, there's agitation, like mental agitation with it. If you've ever seen somebody with severe eczema, I mean, I've treated quite a few patients with whole body eczema, head to toe, and you're not doing local points, right? How are you treating this? Well, one of the things you have to do is calm the mind and calm the shem, because they can't sleep because they're itching all night, and this kind of thing. So that's a little bit important in those situations, and also it works with the blood a little bit. So often in those cases there is some element of blood heat, trying to cool the blood down. If there's a deficiency, then we use all of these points here. This should be the Dadu spleen to the Ying spring point. Can remove damp heat. It is the draining, in this case we're using it as a draining or clearing point. Okay, so they're doing strong stimulation, 3-minute stimulation, right? 3-minute stimulation, 2 to 3 centimeters, about using a 1.5 chin needle and going in maybe 1 chin depth. Okay, spleen 10 can be deeper and going superior, getting the sensation to travel up the spleen channel to the abdomen, retaining the 20-minute needle retention, 6 course of treatment once every 2 days.
These 2 points we can do 14.
It's not really indicating here. Most of the time, if it's damp heat or if it's exterior, you're going to reduce. Spleen 10 actually, they're using the chi traveling method, so they're doing even stimulations. What's indicating, it doesn't say to tonify or sedate. Usually, when you're doing that strong stimulation, though, it's a sedating in nature, right? When you're for that long. Occasionally we can use moxa locally. We can use moxa on DO 14 if it's, if we want to activate the yang meridians here. Once every 2 days, 5 to 7 cones for each acupoint. Auricular therapy.
Excuse me. Is there any guidelines for the frequency of the sessions and duration? General
guidelines for pretty much all conditions, ideally, and in China, they are done once a day or every other day, or at most, or at least usually 3 times a week, whenever at the initial courses of treatment. So, you're going anywhere from, anywhere from 1 to 3 days. In Canada and North America, it's very difficult to get that level. In acute problems, I go for twice a week, and that's usually the best I can get from most patients. So, the general rule is when the disease is acute, treat more frequently. It'll get better faster. They usually have to do anywhere from 6 to 12 sessions in a row, is the ideal before they're getting, good change. And then you're tapering it off. So, you're doing a lot better. Come back in 2 weeks, make sure it hasn't come back, and then you do something for a couple months, make sure there's been no reoccurrence. That's the ideal.
In terms of duration, is there any guidelines?
20 minutes is standard, but we know that there's other, so, sometimes we just go in and out, or if you're doing bleeding or cupping or these kinds of things, that 20 minutes is the standard needle retention time. Yeah.
Because sometimes we're required to do 1 hour, so I don't know. What is this 1 hour?
Well,
understand the
okay, so from the time the patient walks in, you're doing an intake and diagnosis, and I don't know about you, but that always takes me at least 10 minutes, right? That's at least 10 minutes. There's another 5 minutes of discussion with the patient usually, which is might be dietary counseling, lifestyle counseling, this, that, the other thing. There's another transition time when you say, okay, well, I'm going to work on these areas of the body. I'll leave the room. I'll let you, take your shirt off, lie down on the table, blah, blah, blah. So you're already 20 minutes in at that time. Now you have to do the treatment, which is usually, I can needle like a ninja. I can throw 30 needles in somebody in 1 minute flat easily, but I don't always work like that. Sometimes I'm doing massage and cupping, so 10 plus minutes for treatment, to get the treatment going. Then you leave for 20 minutes. Now you're up to 50 minutes, right?
Documentation.
What's that?
Documentation.
documentation, 10 minutes, or needle withdrawal, and the outtake, all this stuff. Yeah, I mean that's how the 20-minute needle retention is just. That's when I work in multiple rooms, so it's not quite so easy. But if you're working in a single room, when the needles are in, that's when you do all your documentation.
So do you usually have a patient, before you do your tongue pulse, especially pulse, do you have them lie there for a little bit until I would think, relax and normalize a bit, or does that make any difference at all?
I would not have them lie there. I mean, to be honest, most of my patients are sitting and waiting for 10 minutes before I bring them in the room anyways. I mean,
so that
like, there's usually, and, I mean, when you go through the 10-minute intake, you do the pulse at the end. Really, the only effect is on the pulse. So, if I feel like if somebody comes in kind of rushing, they're like, just relax, all right, it's all good. Sometimes I will have them get on the table and do the pulse in those situations when they're right before I needle. Yeah. All right. Xingre, clear heat. Okay. I don't know, let's see what other formulas are listed here. Okay. All right. So there's a lot of formulas listed here. I'm going to say the first formula I always think of with eczema is what? What formula do you think of when I say eczema? What formula is often used? Yeah. No, it's not this one. I think of Xiaofengsan. For itchiness in the skin, and it also, that formula specifically, where these are a little bit more specific, that formula contains Xiao Fengsan, Xiaofengsan, because that formula treats damp heat, clears wind, cools blood, and nourishes the blood. So it has, a lot of pretty much every major pattern is somehow addressed, but it's put in the category of damp heat. This one here, if you look at it a little bit more of a heat, fire clearing. This is a very, very cold formula. It's got long dan sao, right? So it's similar to liver fire, all right? Shuling Chushi, okay, Shuling Chushi. This also drains dampness. This is focusing on dampness. This whole group here, this should be ZHU, Songju, not Songshu. This should also be ZHU, Chao Bai Ju, not Chao Bai Shu. ZHU, right? Proper pinyin would be ZHU. So these two, tonified spleen and dry dampness, and then actually from here, Fuling, Zixie, Zhuling, Yi, Ren, they drain dampness and increase urination. So when we have damp predominance, this is the formula. All right, Ho Po, that should be an O, Chen Pi, Hua Shi, Difuzi, these actually all work with dampness still. I mean, transforming damp a little bit, but mostly this all of these herbs work with getting dampness out of the body. So if you have a lot of exudate, right, a lot of weeping eczema, then this is probably better. Yang, Shui, Chu, Feng, Tang. So yang, Shui is blood, right? Feng is wind, right? So this is to nourish the blood and clear the wind, right? So you see the herbs nourish and cool a little bit. This should be CHAO, Chao, Bai, BAI. There's lots of typos in this. Bai Shao, Chao Bai Shao. Okay, Danshen, Ji Shui Tang. So the vines, really, I'm going through the herbs quickly because I know the majority of you are not doing the herbs, but the vines, the tongues, clear wind, they go through the pathways and we see that usage here. Bi-G-Li is used for itching. It's also used. What other formula uses this? So another, this Yang Shui Chufeng Tang is good. There's another formula that tonifies the blood and clears wind, which is what? So, anybody? Okay. Okay. I'm going to let you go through those on your own. What you see here is the 3-edge needles. Other treatment methods within the scope of practice of TCM with eczema. We can do, of course, local needling. So we use the term surround the dragon. We go half chun from the border of the eczema and usually about 1 centimeter apart, to an inch apart, and just circle the area. If it's a confined area, it doesn't work when it's a large area, but we do that when it's a smaller area. We can use bleeding. You have to be a little bit careful about how you apply it. The general rule is you never puncture damaged skin. Of course, eczema is damaged skin, so you have to be a little bit careful. You put even rubbing alcohol on it, the patient's going to scream and hit you. Okay, but also because there's increased risk of infections whenever you do that. But traditionally, often they will use the blood pricking method, the spot pricking method on the eczema itself. They will also traditionally use the fire needle method on the weeping eczema when it's kind of damp predominant. They'll use the fire needle. I don't know if you've ever seen that, but make the needle white hot and go in and out kind of thing. Yeah, these are more advanced techniques, and there's so the 7-star needles, right? So according with the safety guidelines, my advice to you would be never go into the damaged skin. So again, sometimes they do it on the eczema, but what you can do is do it surrounding and circling the area. The basic pathogenesis of most of these dermatological conditions is that as soon as there's a skin problem, you get obstruction in the area, which hinders it from healing. It's like a vicious cycle somebody's skin gets into. So circling an area helps to stimulate the qi and blood circulation around it and get it going. Never cupping on damaged skin either. I mean, there are definitely clean and safe ways to do some of these things, but in general, I would stay away from it. Take 5. I'm going to start while we're, settling in, getting your summary sheets and whatnot.
So you go with the one on the second? That would be so we can be ready for the next, right?
Yeah, today, so that next week they have the study for next week, right?
Yes, that's why we need the one on the second.
Okay, so this is on the website. Has anybody here not read this? If this is new to you,
I think we had this last week.
This is on the website.
Yes, but
Yeah.
other professor.
Right.
Different case, you mean?
No.
It's the same case. The point is it's the same information that I put up on the board earlier. When you're talking about asking for the template, you know, I'm assuming that everybody's read this and knows the template of the exam, right? This is the template of the exam. You're given a brief health history, right? Patient information, demographics, et cetera, you're given basic assessment information, right? Which is here, which are, you know, this is really simple. You know, this case, the case and the way it's laid out is very simple and straightforward, right? Okay? And then you're expected to be able to fill this out, which is kind of what I wrote. All right, TCM diagnosis has two parts. So when I'm in student clinic, when we have this in student clinic, you can differentiate the disease and the pattern differentiation, but a TCM diagnosis actually contains both. I don't know if you think about that, but you know, so for example, we can say deafness caused by blank, you know, exterior wind attacking the Shaoyang. That would be a TCM diagnosis. But both parts, the illness or disease, you know, I think that they want us to use illness because disease is biomedical in nature. If you say a disease diagnosis, that's why we use illness, as far as I know. And then syndrome differentiation, of course, are the patterns. And then you have to explain your reasons for diagnosis. This is what I was saying. You know, this is the gap that most non-TCM trained acupuncturists have. If you can't explain, then you're not going to get, even if you choose the right points, if you don't know why and you're just going out of the book, right? There's a sections of the notes that do give explanations as for why, but you should be able to link the signs and symptoms that are given in the last with the diagnosis. So if we go back here, and they have their own answer sheet, but if I do it on my own, you know, temporary or acute since yesterday with headache, all right, what is the differential diagnosis at this point? What are the common acute deafness with headache that we think of? There's two. What are they? If you just say acute deafness with headache, we think what? Either exterior or from liver yang rising liver fire, right? So both of these will cause acute deafness with headache, right? So you know, the differential is now, okay, so which one is it? I mean, already I read one line, I know it's one of those two. At least, you know, pretty sure that it's one of those two. Feels irritable. Any unhappy or stressful thoughts make it worse. Okay, this is more of a liver type. So it says temporary in one day, i.e. acute, and it says headache, but it doesn't have all the signs and symptoms of wind attacking the exterior. Does that make sense? I mean, if you should be able to see that by now based on today's class, right? Then we go further down, we see that there's a liver, the key liver components of irritability, stressfulness, etc., etc. Go further down. Now we have the kind of constitutional questions. Red face, heat, right? Talkative and loud, yang condition, excess, can't focus, difficulty falling asleep. That's interesting. Now it's going to give us more information. Mind is active during sleep with many dreams, but can't remember. What does that indicate? Is there heart stuff? To me, this is just still in line with the excessive heat inside the body, agitating him at night right now. Mouth feels bitter. Liver heat, liver fire. Thirsty, prefers cool drinks, right? Heat inside the body. Many clots in the menstruation, right? Some stagnation. There may be some stagnation. Likely here, it's connected to the liver, which regulates menstrual blood. Okay? So here's an example of what I didn't actually have recently at least, I did when this first came out a long time ago, but recently I didn't look at it, but I would probably not discuss that symptom because I'm not treating it. So in my diagnosis and reason for diagnosis, what you want to do is you want to say, I'm diagnosing this as liver fire, something like this, or, constipation, I'd probably say it's more of a liver fire rising upwards. And the reason is because of A, B, C, and D. The clotting menstruation is really it's a second thing. I don't really have to take the time to write it out and explain that part because it's not part of my diagnosis.
Maybe trying to say this is like a predisposing factor.
What's a predisposing factor?
It's like something, a weakness that she has in the body before this incident happened. This led to...
What led?
The increased liver yang, or excess in the liver. It predisposed her to have that increase. Because before she had the argument with her doctor, the yang liver was increased. Then she had that episode that increased that and turned it into fire that led to the deafness.
Well, you're making assumptions. I mean, I'm not sure what the rationale there. Yes, that's possible, but that's not what the case says. So I would encourage you when you...
What's the significance of that piece of information?
Which piece of information?
Many clots and menstruation for the past few months.
So I don't know why, because that's totally different than what you just said, though. You were just talking about her fire that then, got triggered by the emotional disagreement with the daughter. The clots is different.
You just said that this thing happened to her a few months before she had this episode, right?
What happened a few months before her episode?
The clots and menstruation that she had a few months and nothing for 1 day, say something.
Okay.
Okay, so that temporary thing is something that happened after this.
Yes, and?
So this thing is the predisposing factor. This is what led to that.
So because she had clots in her menstruation, she now is deaf?
No. What's the cause of the clot and menstruation? It was the increased
liver obstruction. Liver function is affected.
She had liver obstruction function for a prolonged period of time. Then she had
that I'm not convinced with. A few months is not a long period of time, and there's nothing else that shows that, right? So there's no rib side distension, no digestive irregularity, which are the signs of liver stagnation. So if there was a pattern, not a symptom, of liver stagnation that existed for months and then became signs and symptoms of heat, I would agree with you. However, the way that these signs and symptoms are written does not indicate that level of pattern progression, right? So the reason I'm saying that is because you should be careful about making assumptions.
So why would they give you a piece of information that has no relevance at all to this?
It does have relevance. It is indicating a liver problem, but the whole case is a liver pattern.
Yeah. So in the uterus, liver related.
Liver regulates menstrual blood.
But they say here for the past few months, and now we're talking about something that happened a day ago. 1 day.
Yep, that's right. Because this is for a number of reasons. One is because menstruation is always something we ask about no matter what. So we always have some information. In this case, that information happens to match our pattern, which is good, right? I mean, the reason it's there is because she's a female, and that gives us diagnostic information. We always ask about it. Every single female you ever do acupuncture to, you are supposed to ask how their menstruation is going.
I think what he's asking is, would you say that it was like liver stagnation leading to liver fire?
What I'm saying is that there is not objective information to support that, right?
There's only one sign.
There's only one sign, exactly. There's no pattern that supports that. And so if you're going to write that down as part of your diagnosis is what I'm cautioning against, because you can't support it. So you're making it more complicated than it needs to be.
But does liver fire come out of nothing, or is it usually a predisposing
Liver fire, so one of the questions Azza asked earlier today was, what is the difference between liver stagnant heat, which is what usually comes out of liver stagnation, and liver fire? So can liver fire, is there a relationship between liver stagnation and liver fire? Yes. The livers, as soon as the liver is involved, there's an effect on the smooth and even distribution of qi and blood, because that's the role of the liver. However, in this case, I don't think that the stagnation is not present. So if you look up liver qi stagnation or liver blood stagnation as a pattern, the primary pattern is obstruction, right? It's not moving, it's not circulating. And to treat it, we disperse and move. And here, yeah, but I mean, I still, you know, everything is heat. Everything is heat, right? Everything is heat, even red tongue, yellow coating, right? Everything is like liver fire, liver heat.
It might be similar to, you don't have that hypochondriac pain. That's almost always with stagnation.
That's right.
It doesn't mention that. It makes it easier to diagnose.
Yeah, right. The real reason I jumped on you for that, though, is because I think it's important when you're writing the case studies to keep that in mind. I spend time even with, you know, diploma program students, getting them not to take one little thing and run with it and make an assumption, right? Yeah, so always look for a cohesive pattern, and never think about it like being in law, in court. So just like what I did with you, prove it. If you're going to say it, you have to prove it. Show me the signs and symptoms that prove that that's the progression, or that that's the pattern, right? In this case, liver stagnation that led to that. Now, you know, it makes sense?
Yes.
Kind of.
In my thought process, they would not provide you any information to mislead you.
This is not misleading, though.
Yeah, but I mean, what do we get out of that? Many clots and menstruation for the past 2 months. Every word that they mentioned there should have some indication for something.
To me, it indicates a slight dysfunction of the regulation of the menstrual blood from the liver. If you look up like liver stagnation menstruation, what you see is irregular menstruation, right? May or may not have clots. If there's dark clots, which they don't say, they would say blood stasis, right? And severe pain and cramps, which they also don't say, right? So in my mind, I'm comparing what they do give me, which is just many clots for the past few months, with those two patterns in my mind. Okay, is that indicating a major liver qi and blood stagnation problem, or is it indicating blood stasis or something with severe cramping? But everything else is saying liver fire, and you're trying to make that differential diagnosis between qi stagnation and liver heat, because the treatment principle and the point selection is different. And so if you confuse yourself, now, you know, you get into that situation. I know some of the cases I put up earlier are complex like that, right? Where it's, you know, it may be a complex case, but most of them should be more straightforward, a little bit more straightforward. And if you confuse yourself, differential diagnosis means to differentiate between liver heat and liver stagnation, right? Which one do you treat? Which formula do you use? You don't use both, so which one, right? Okay. Yes.
They don't want to mislead us, but they try to trick us.
They try to trick you. So that, I mean, this would be an example of, they almost always don't assume that everything is important or that everything will match. Assume that 9 out of the 10 will indicate one pattern, but one is going to be like, and, you know, liver heat, and they had diarrhea. I don't know. Well, that shouldn't be the case, but I'm just using an example of one thing that doesn't quite match. You know, right? More than one. So 6 out of 10 versus 4 out of 10, right?
Yeah, it's
Okay.
really confusing.
So looking, just to review the level of expectation of understanding of these patterns that we're going through right now, and again, I won't spend any more time. If you said that Leo went through this already, you should reread this again. So, this is your sample that you're given, and you're expected to be able to describe a TCM, whoops.
Sorry, I forgot to read that.
It's okay. You're expected to be able to describe a TCM disease diagnosis according to the signs and symptoms to this level, right? So if you read this and you're like, you have a little bit of studying up to do, and yeah. Okay? All right. What section are we on?
Herpes.
Herpes. Great.
That's exciting.
Well, I will say that this second half is, anyways.
Yeah, oh, you're crossing.
Where is it?
It's right there, number 8.
Number 8.
Ah, I see, it's cut off there. So, what is the main patterns of herpes, okay? What is the primary diagnosis of a current herpes outbreak, an acute flare-up? And now, heat, where?
External.
External?
Well, maybe not. Though.
It is in Wicca.
Yeah.
Where is the heat?
This is deeper like this. This is only from inside.
Where is the heat? So where are the, most of the time, sorry, herpes zoster is liver gallbladder, right? Mm-hmm. So where did it manifest? Is the rib cage area. What is this in TCM? Liver and gallbladder meridian. In Wicca, again, when you have superficial conditions, always think, what channel is it in? It's heat, yes. It's usually also damp heat, all right? Main manifestations, clinical manifestations, we know that it travels along the nerve, right? Pathways, so it can have various manifestations, but the most common one is the rib side area, traveling along the nerve. It is generally extremely painful, okay? The onset, when it's red and blisters, we look at it as a liver fire, liver heat, damp heat in the liver, something depending again on whether it's weeping or not, right? If there's a lot of the blisters versus if it's just red and irritated. When it's severely painful, we combine that with blood stasis, all right? And then in the latter stages, so after the acute outbreak, when it's healing, we're usually combining with some deficiency underlying, all right? Yes?
It is acute. It is heat only. Because it is acute, like the eczema. It is heat or wind heat.
So this is, because this almost comes from inside out, where eczema is more superficial. So usually this is seen as a liver fire actually coming out from inside to the skin rather than wind from outside in. We never treat this as exterior wind usually. Yeah, there are some, you can get herpes zoster in other nerve pathways, so there's other cases where you have it like in the face, and then we look at things like toxic heat, toxic wind heat, and things like that in some of those, but most of the time we're not treating with, GB20 and DO14 and these kinds of exterior wind points. Yeah. Okay. So mostly related to liver and gallbladder damp heat. The spleen channel has some relationship. I don't know how much you guys remember, but The spleen channel kind of comes up here and is often involved when there's damp predominance. If there's a lot of dampness, then we'll have some spleen involvement. But the primary pattern is damp heat, which then we can get fire. Sometimes people feel it as a burning and there's predominant redness, and then it can be blood stagnation as well. All right. Signs and symptoms of herpes zoster, everybody knows, correct? We don't have to go through that. If you don't know it, let me know. So we can think about the descriptors of the blisters as giving us some indication. So if they say that there's, bulla or fluid-filled blisters, there may be a predominance of dampness, and that's one stage of certain. Or if they say that it's red, or if they say versus, light red or barely red, these all give us some indication about what pattern they may be saying. And then the internal symptoms, if it's liver, damp heat in the liver, we're looking for heat signs internally, right? Looking for redness, thirst, redness of the tongue, thirst, redness in the complexion, irritability, bitter taste in the mouth. If it is lighter in color with a lot of the yellowish white blisters, then we look at a lot of the liquid discharge, right? Not as red. Okay, and then some other internal signs of bloating, distension, or spleen weakness. Yellow, greasier tongue coating showing predominance of dampness, although still a little bit of heat, predominance of dampness. And slippery, rapid pulse indicating spleen deficiency with damp, I'd almost describe it as a damp toxin or something. And then the residual, now, generally speaking, in treatment, we would say that blood stagnation is more a level of severity. So whenever the patient has severe pain, pricking or stabbing pain in the area of the herpes, we usually treat it as blood stagnation, whether it's combined, and that's often combined with the other pattern. So, it's more like we use this formula to treat at these points, and then if there's also severe stagnant blood, right, blood stagnation, signs and symptoms, severe pain, stabbing pain, then we add these herbs or add these points to it. Usually it's seen that way. Principal points, the huato jiaji. It is a nerve problem, so we use the huato jiaji along the affected spine, right? The affected innervations, whatever's being the section that's being affected. Okay, Li4 for pain, Li11 to clear heat. Major points, usually again, this uses liver 3. I would likely use liver 2 again here. I use liver 2 whenever there's heat clearing, fire in the liver. Sanjiao 6 we can use. Spleen 10, specifically for blood heat and blood stagnation. Spleen 10, shui hai, blood C. Spleen 9, if there's the damp pattern, right? If damp predominance, then we add spleen 9 in. We also usually use circle the dragon, the local needling around the skin lesion. General rule is a centimeter from the border, and we're going under. You would never do this with a cyst or something where you would risk, if there's any risk of puncturing an external condition like a cyst, that would be bad news because you can get the infection into the blood, right? So we do this with certain, eczema and herpes zoster. We can do that though, right? Circling the area that's affected. Again, actually similar to eczema, when there's severe pain, we sometimes do the blood pricking method in the area. And, in China, they usually do cupping and bleeding. So they do the pricking of the blood around the area that's affected, and then they put the cup on it, get the blood out, and this is for that blood stasis pattern. Right? You have to be very careful with, you better be sterilizing your cups when you're doing that, right? Better not be using plastic cups either. Throw away your plastic cups. Get rid of them.
In general or just for this?
In general.
Why?
Why?
It's why you said sterilized.
Because you can't clean plastic properly.
We don't use for bleeding.
Yeah, but you have fire stuff, like in your clinic and stuff, that's one problem.
Just my 2 cents. That's my 2 cents. Yeah. We won't spend time on that discussion though.
I agree with you,
All right, so other major points. When there's liver involvement, front move point of the liver 14. Gallbladder 34, I'll skip PC7. I don't think that, but that's as clinically important as gallbladder 34. Gallbladder 34 is a major point for damp heat in the gallbladder channel. Remember, the manifestation, even though we usually see it as liver organ function, the channel of the gallbladder also comes through here. So liver and liver just kind of comes up in the front here. It's usually the gallbladder that wraps around to this area. Yeah. So we're often trying to clear the excess pathogen, in this case damp heat, through the gallbladder channel. Li4 clearing heat, and important here for pain, right? Li4 hugu we use all the time for pain. So it's just, we use it for every case of acupuncture anesthesia because of the strong sensation we get. Helps with pain. Stomach 44, if there's herpes zoster in the face, yeah, stomach 44. Clear the heat and fire. Again, yin spring point. You have to know the function here because they're not all written in the notes here. Not all the point functions are written down here. Stomach 44 clears heat from the yang ming. The face is yang ming. The reason we use it is to clear the heat. Do 14 clears heat from the body, right? Vents heat, clears fire. That's why we're using it, right? Reduce fever. PC4, heart 7 to calm the heart, clear heat from the heart. GB38 for neuralgia. Neuralgia. Okay.
Whichever one was that one? GB38?
It's really
But what are you saying, GB28?
It's a low, it's a she cleft point. It's Y, right? What's the she cleft point of the yang? I'm pretty sure, I could be wrong, but there's 2 she cleft points.
Yes.
Yang Chamai and 36 and 35. So why are they using 38? Jing River point. Jing River. You'd have to look that up. Right. What time do we have until? I just want to try and we have until 5. I just want to try and make sure I manage the time because it's 4 o'clock already, right? So the way that you should be thinking, each of these diseases has primary patterns with, there's point modifications for other sub patterns that are affecting it, right? As long as you're there, it should be good. I would say that we should be careful about this being the most effective. Herbology is also very effective, but acumoxa treatment is very effective for reducing pain, right? It's what, we get instant pain relief usually. That's why we're saying that here. Empirical formulas, Yu Shen Wan, but we probably most of the time use Longdan Xiegan Tang. So most common formula for herpes, Longdan Xiegan Tang. Okay? Sam can tell you it's not written down there. It's
How do you spell it?
this is yeah. So
L-O-N-G.
Long, this is this herb here, Longdan Sao, Longdan, okay?
No, I'm not sure.
Not yet?
Maybe write it.
You want me to write it?
Yeah, if you could, that
Long, L-O-N-G, Dan, D-A-N, Xie, X-I-E, Xie, Gan, G-A-N, liver, Tang, decoction. Longdan is the name of the herb, which is listed there. That first one, Longdan Sao. Xiegan means clear the liver, drain the liver, right? Drain the liver. So Longdan, drain the liver decoction. Most important for this fire and damp heat, with excessive heat, not for long-term use. Okay?
what's that? How long is it?
Generally a few weeks, like 2 weeks, I would say, would be typically the longest that formula would be given for in most situations, right? How do I make this fit width? Right. All right, so here's a nice, good, straightforward case study. This is, so a 45-year-old patient had skin rashes on the right side and back of the abdomen coupled with pain. So right away there, you may not be given that it's herpes zoster, and you're expected to know that that's the most likely scenario for those signs and symptoms. Prior to the treatment, the patient experienced pain on the right side of the lower back, the abdomen, along with skin rashes. The pain became aggravated at night. The examination, this is key, showed a strip of red-colored, rosary-like blisters on the right side of the lower back. So it's indicating this line, which is that following of a nerve, right? And abdomen. The tongue is red with a yellow greasy coating. The pulse is wiry and rapid. Imagine that's all that you're given. That's it. That's what you're given. All right. When I block it out up here, it doesn't block it out up there. I'm blocking out here, like you can't see it now. All right. So, that's what you're given, and you're expected to make a diagnosis. Right? This is so simple because it just matches what the textbook says, which is, well, this looks like damp heat in the liver. All right, even from TCM Foundations, wiry indicates liver, rapid indicates heat, right? Yellow greasy coating indicates damp heat, red tongue indicates heat. We don't have a whole lot of differentiation of the herpes itself because it doesn't lean more towards dampness in this case, for example. All right, but it's a damp heat, but it's not like what our textbook kind of goes into, like a predominant pattern. This is just straight up damp heat in the liver and gallbladder channel. Treatment principle.
Sorry.
Yeah.
You said that we diagnose something that we want to treat. Right. We want to treat and we treat it down. Why we didn't put in the diagnosis?
So we're not really treating much dampness here. It's not the same as the dampness we talked about when compared to damp heat, right? If we had significant, so if you go back and you look at the notes, I don't even know if you have the same notes that they have, right? But the section before where we said, if there's dampness, damp predominance, they will also have A, B, C, and D, right, symptoms, and they'll have blisters that are weeping with a lot of fluid, right, and bloating and distension in the middle part and a slippery pulse, right? So this is what you're trying to differentiate between. Mostly here we are red, right? Red color. It just says blisters, but it doesn't really indicate that they're bulla that. Sorry? We have a greasy coating, that's right, but that's it. You know, the pulse doesn't differentiate. I mean, greasy coating from TCM perspective absolutely could be present with damp heat as well. So, you know, from my perspective, there's just nothing that's uniquely damp about this case. It's just damp heat in the liver and gallbladder channel. So I'm treating it in that way. I don't feel like I need to really work with spleen at all. There's no sign of spleen weakness per se. You know, my focus of my treatment should be on the liver, clearing damp heat from that channel. I don't need to strengthen the function of the spleen, right? So you ask, are you treating dampness? That's actually how I'm looking at it. Do I need to treat the spleen here at all? Not really, right? I'm treating the damp heat in the channel through the other points. And this, by the way, this does drain dampness a little bit. Gallbladder, if you wrote down liver and gallbladder, that's fine, right? You know, that would be fine. The formula does have that function, right? But we focus on the yin organ function, right? You know, the pattern is attributed to the liver as an organ, and the channel is the gallbladder. The formula goes into the organ. Okay. Next one. Here's another case. So 52 papullovesicles on the left side of the chest and rib coupled with pain for 2 weeks. 2 weeks, the patient experienced blisters of the size of a soybean, okay, on the left flank and back, coupled with agonizing pain that affected the sleep. Dry mouth with bitter taste was also present. Physical examination showed a band of red-colored papullovesicles from the left flank to the area inferior to the breast along the 6th and 7th ribs. Now talk to me. Okay? Right? Wiry and slippery with a thin coating. It's a little bit different here. All right? A little bit different here. Yeah. So they're by toxic, so toxins often refer to purulent discharge or pus. So that's what they're treating here. Shi chuan chang chuang shi chuan chang chuang. Okay. See there we go. Oh no, this is another case. How come it moves so quickly? Why do I lose that? Okay. Okay, I guess there isn't anymore. There's no specific here.
If it is toxicity, why the is teeth? It should be red and yellow.
That's right, but all the other signs and symptoms indicate that, right? So this is maybe a good example of.
If the pulse is wiry and slippery, that means that it is damp heat. I don't know
Liver fibers.
why they said that toxic.
But they say heat accumulating in the liver.
Yeah, their diagnosis is heat accumulating in the liver
Yeah.
channel, right? Liver channel here. One of the things that I like to do when I look at case studies is look at the treatments themselves and work backwards. I don't know if that's helpful, but you know, what I do see here in terms of the treatment is that they're mostly treating it almost as blood heat, liver heat, and blood heat, because they're using spleen 10. Liver 2, spleen, and that's all that they really give us, and then local. Yeah. There is heat. Yeah. And there's liver involvement. I mean, it's not that different, but there's less, maybe less gallbladder channel involvement. I don't know if they even gave us points for that last one, did they? They just gave herbs in the last one. They did not do points. Yeah. Okay. So, think about it this way. You know, think this way. When you're marking, when they're grading a case study, again, if you use another point that performs the same function that they would be wanting you to use, right? So they're using spleen 10 to cool blood, right? So if you use another point that had that similar function, they'd have to give you credit for that. The bigger problem is not knowing that that's what you want to do or that's what you need to do in any given case, right? This case is quite confusing, to be honest. It's not straightforward. The reason it's not straightforward is because when I read through it, let me go back again. So first of all, papulovesicles, all right? Papulovesicles, we see vesicles on the side of the chest back coupled with pain, right? There's usually pain, so that doesn't mean that much to me. There was agonizing pain that affected the sleep. So, you know, this is, again, to me, from my perspective, it's common with herpes zoster. But when that term agonizing, remember I said that blood stagnation is kind of usually seen as a degree in herpes zoster. It's a question of whether or not you want to move the blood, not really whether or not it's blood stagnation or heat in the liver, for example. So when I see agonizing pain that affected sleep, I would certainly think of that. Dry mouth with bitter taste indicates pretty clear heat. Now a thin tongue coating here, this is why they say blood heat. It's not normal thin, it's pathologically thin. So I think that that's the catch with this case. Yeah.
Question. When we write the toxic heat, means that we heat the blood level?
Not always. Not always. No. Blood level heat, so there's two different categories of treatment. One is to cool the blood or clear heat from the blood, and one is to clear toxic heat. I mean, there's a category of herbs that are used for cancers and other severe infections that what we deem as toxic heat. In fact, even when we were talking sore throat, I didn't go through the cases, but I did mention the one case where it's strep throat as opposed to sore throat. Usually that's considered a toxic heat, toxic fire. And the heat toxins that accumulate often are bacterial infections or something like this. It's a little bit different than heat in the blood. If the heat toxin enters the blood, now we have heat toxin in the blood. But blood heat is just heat in the blood level. Toxic heat is a certain type of heat. Okay, next, moving on, right? What do we have? Acne?
Behind
Cruising along. Anybody besides me need like a 2-minute break before you go? Okay. Mostly just because my voice is starting to get did I start that correctly? Yeah. There's no need for me to play it for you in this class, but go to the CTCMPO, follow the links to the PLAR information. This was just on the, on the licensing or the professional testing page. There was a link of instructions, and it looks like this is a sample sheet here, okay? So it is a digital test, right? It looks like you're gonna have to type that information in.
Oh, really? You put your, computers in?
Yeah, you have to.
So if you have lack of computer skills,
Get one.
You bring in your assistant?
you might want somebody to type for you. I don't know how that works. I'm not sure what, but I imagine that that's an accessibility issue. I mean, they can't require that we're touch typers, right? So I'm not quite sure how to answer that question, but it is a good thing to know that it's a computer submitted exam. It might be possible that you can write the answers and send them photos of the written answers too. I'm not sure.
On there, does it tell you where to get the marks from each question or each part of the answer?
I thought it was in this document. Okay, so I don't think it's here right now. Yeah, I'm not entirely sure if it's the same as the Pan-Canadian exams or not, but I would assume that it is. And if that's the case, I think it's 1 point for the illness, 2 points for the pattern differentiation, like 3 points for the explanation, and 2 points for the treatment itself, something like that. Yeah. I have it somewhere, but I just haven't looked at it in a while, but it was something like that. Okay, different weighting. What's that?
Out of 10, probably.
Something like that, yeah. So, there's a little bit more weight towards a few of the areas, but usually it's where you're writing more. So they put more weight on that. All right, so acne, real common condition. I'm going to speed through this actually, if that's okay, because it's almost 4:30. Most common in young adults, major patterns. So I'll just go out of my head if that's okay, and then we'll look at the treatments themselves. Major patterns include wind heat. This is from the textbook. Include wind heat attacking the exterior, so this is kind of acute, and superficial papules, usually on the forehead, is related to the lung area, the forehead lung area. The second major pattern is damp heat in the stomach and intestines, Yongming area, damp heat, so these are redder, greasier skin. That's a deeper, redder boils. You can come on in and greasier skin type, all right? And then usually there's digestive relationship with this, right? So, people that get aggravated around. so much. There's not, at least in the main textbook that they list, doesn't have a liver gallbladder pattern related to acne. The third major type, I'm not saying you won't see something like that, I'm just saying it doesn't have it as one of the major patterns. The third major type is blood stasis, which is basically the purplish colored cystic acne with scarring, right? So usually it's, dark colored pustules, and there's usually pock marks, and sometimes, other types of scarring, and there may be pain, there might be more blood in the acne, and then there should be other signs and symptoms associated with blood stagnation or poor circulation of qi and blood. So these are the three major types. Most of it can be categorized or separated by the onset and the nature of the acne, but just to review, wind heat on the exterior, usually you're looking, we should also say that acne mostly assumes yang ming area, face area, right? So, but acute, exterior wind acne is going to be acute. Like I said, superficial, meaning not like deep, painful pustules, not a lot of pus, right? With damp heat, you might have more pus. Pus is pathogenic damp, whatever. And what else?
Question.
Yes.
From what I learned in China, but I kind of forgot. Is it like when you see a person, the acne went on the face, the location actually?
Sure. So forehead usually pertains more to lung. This area to the stomach, right? Stomach meridian. This area to the kidney. And those are the major areas.
But some people could have one on one side. They have more.
It could. If it's more predominant on one side, then we can use the other model of the diagnostic, which has the wood energy or the liver rising on the left side and the spleen on the right side of the face, and the heart in the upper part, and the kidney in the lower part. So we could use that model if it's a unilateral. Yeah. Sorry? So there's two models of face diagnosis. One is the microsystem, in which case the heart and lungs are basically here, heart here, and lungs actually in the forehead area. This is what the Wu's head massage uses. And spleen and liver are here, being in the center. And then we have kind of like intestines and kidneys down here, right? That's one model. And then the other model puts the 5 elements in puts the 5 elements on the face and says that, the wood energy rises on the left side, lung is on the right. You're right. Yeah, spleen is in the center, and kidney and heart. Yeah, thanks. Correct. Sometimes I go too fast for my own good. All right. So these are we can use that, but the major, aside from that, that's like a subtler diagnosis, right? The major patterns, you want to think of these 3. All right, major points is usually, again, clearing heat from the yang ming. Same points. See how easy that is? Same points over and over and over, right? Stomach 2 and yang bai are just local points. No big deal, right? No big deal. Same. All right? Supplementary points. Why do we do these? LI4 because command point of the head and face and because it clears heat. LI11 because it clears heat from the yang ming. Stomach 44 because it clears heat from the stomach. All the, most of the acne is heat, redness, right? There's heat, inflammation. Stomach 2 and gallbladder 14 are just local. Lung 11 can be added for clearing lung heat. Okay, clearing heat from the lung. Lung 5, all right. Bladder 12 for the pattern of wind heat in the lung. Stomach 36, spleen 6, spleen 9 for damp heat in the spleen and stomach. and then spleen 10 and UB17 for blood stagnation, right? And spleen 6 for blood stagnation. Clear? Good.
How you can explain the asthma with the puberty?
With the what?
Puberty, that all of the asthma started when the puberty,
So there's a hormonal component there, but in TCM it's mostly because they're abundant in yang at that time, right? So this excessive yang energy in the yang part of the body causing yang type stagnations is, we kind of can think of it in that way. Oops. Any questions on the reasoning here? I've kind of very loosely or quickly went over that, but I'll leave you to study this on your own. Okay. Ear points, auricular acupuncture. Sympathetic, not sympathis, I don't know what that word is. Sympathesis should be sympathetic, right?
Yeah.
Okay. Large intestine and lung govern the skin, so it's a metal element issue. Ear apex is if there's heat, and especially if there's exterior heat, we're going to use. All right. Oops. What did I do? Okay. Diet. Diet is always advisable to look at. Make sure that everything else is working inside of their body. This doesn't really take too much into account for the interior patterns. Major herbal prescriptions, Pipa, Qingfei Yin. So Pipa, clearing the heat, is for exterior wind heat. Huangyan Jiedu Tang for draining damp heat and fire from the interior. Urge and Wan. A lot of these there's quite a number of formulas being listed here. Most of you guys are not doing formulas, so we're skipping that section basically, right? Good, okay. And hemorrhoids. All right, what are the main patterns for hemorrhoids? Hemorrhoids are usually the prolapsing, what lifts qi, spleen deficiency, right? Hemorrhoids are usually related to spleen qi deficiency. This may be complicated. There's a few other patterns that can be related to hemorrhoids. Spleen qi sinking is a better terminology. Don't just say spleen qi deficiency. It's a specific subtype of spleen qi deficiency called spleen qi sinking, right? So when we're looking at the sub-patterns, damp heat is another major pattern. So damp heat in the large intestine often irritates hemorrhoids because it pushes outward, like it's actually pushing outward, right? And there may be, I know we're learning them as two separate patterns here, but there may be some kind of mix of these in real life cases. For the most part, if you see signs of spleen deficiency, focus more on that. And if it's all excess signs and symptoms, so bloating and pain in the lower abdomen that is relieved after the bowel movement, and full pulse, no weakness in the spleen system, then you can say damp heat causing, all right? Similar to the herpes zoster, when we have severe pain with the hemorrhoids, we will often describe blood stagnation or add blood stagnation. There are the different types of hemorrhoids, different levels. Whoa, it's loud. different levels of hemorrhoids. What's the word? Not levels. Different stages. What do you call them? Stages. Different. Stage 1, stage 2, stage 3. So whether they're just internal or they're how far out are the hemorrhoids coming, basically. Usually in the second and third types, right, or types, there's blood stasis and there's a lot more pain. They're a lot more difficult to resolve with just acupuncture. Usually you may need other help, right?
It's not related to the kidney deficiency, but not holding
The lower orifices, that would be a less common pattern, and it would almost still definitely involve spleen sinking. So we'd probably treat both. Even if there's kidney involvement, then we would add that in, right? Yeah. So even if you see mostly kidney symptoms, we would probably still treat it as a spleen chi sinking with spleen and kidney deficiency, and because we need to lift, we need to raise, which is a spleen function.
Yeah.
The kidneys will help you go down there, right? They will.
It's more functional, but this is more structural. Yeah.
Right? So the kidneys will help you secure the lower orifices, or like prolapse uterus is another thing. That likely has a kidney weakness component, but it also is still a chi sinking, so we will use both. Okay. So onset, of course, sitting too long, poor diet, eating too many spicy foods. They may be irritated with that. I would also mention, the blood in the stools, right? Sometimes we have blood in the stools with hemorrhoids, especially internal hemorrhoids. A patient may not know that they have hemorrhoids or think that they do, and they just come in, they say, oh, I have blood in my stools, bright red, fresh red blood. They're often aggravated with constipation because of the pushing, trying to push out. All right. Again, if you talking about pattern differentiation, damp heat, we usually have swelling and pain present. With chi deficiency or spleen chi sinking, we have predominant weakness, tiredness, lethargic, and sagging, sinking prolapse. Major points. Well, bladder 57, right? Bladder 35, right? We can use do 1. Oh yeah, they have do 1. Bladder 35 is right next to do 1. Bladder 32, we can also use 31, 33, and 34, which they don't list. All of these can be useful in treating. Major points, I would say, would be 35 and or do 1. We usually don't need to use both of those. Why? You don't like that? Why? Yeah, why would you not? It's a very important point for hemorrhoids. Very important.
People don't like it.
You say do 1?
Yeah, do 1, sure. Yeah, this one's easy to needle. Ren 1's the hard one. Huiyin's the harder one to needle. I mean, you have to, really have them disrobed and carefully draped, But do 1's pretty easy. I mean, because you're treating hemorrhoids, you're just going down just under the tailbone. Boom. Yeah. Okay. Do 1? Yeah. Do 1's a strong lifting. It opens up into the dumai. If you don't want to do 1, then you do 2. Do 2. It's not the same though. It doesn't lift inside in the same way.
Bladder 57 is more important for the hemorrhoid 58. But you have to write 1.
Yeah. I'd have to look them up to tell you. I mean, I don't think that you're going to get them marked wrong for that difference.
I hope that they are. So.
Yeah. You know. Well, I mean, if you're answering, it's not about generosity. I mean, it's a matter of like, are you doing an appropriate treatment or not? Is the question. Yeah. Okay. All right. So other major points that are important, and I would say almost in pure, like I would switch one of these other points with the principal point of do 20. Do 20 is almost always used, and I see it listed here as as another one, but yeah. All right. We can add the large intestine points. If there's damp heat, we can add spleen 9. Ren 8 can be used with moxa, of course, right? You would never needle in Ren 8. You better indicate that on your exam. And what else? If there's constipation, we can move constipation with Sandgel 6 and stomach 25. Okay, let's keep going. All right.
Yeah.
What's that? Is better, right? Okay. Best. Okay, so auricular points we can use. What do you think you're going to use? Anus, right? Rectum, large intestine, major points, major regions of the body. I don't use auricular acupuncture that much, so I'm not a specialist on it. Can't talk as much about that. I would add to this, like what I said in the beginning, usually anything past the first stage hemorrhoids, right, generally need to be treated with, it doesn't mean you can't treat them also, but if they come in, they say I have stage 3 or stage 3 hemorrhoids, can you treat them? I don't want to get surgery. I wouldn't recommend that they don't get surgery, okay? Formulas, what formula do we use for spleen chi sinking? Sam? Spleen chi sinking. Of course, all right? This is the go-to formula for spleen chi sinking. Buzhong Yi Qi Tong. It's not written up there. Oh, let me see if it's coming along. Oh, it's not even there. Wow, look at that. Okay. B-U-Z-H-O-N-G, Buzhong Yi, Y-I-Q-I, Qi Tong, T-A-N-G. Buzhong Yi Qi Tong.
This is for any sinking.
This is for spleen chi sinking. In fact, this is the formula they use in the case that I put up earlier with the head, right? The one where what was it, low blood pressure, right? Where they were having dizziness in the head. And they kept giving Buzhong Yi Qi Tong because they thought, oh, it's a spleen weakness without that, but they weren't tonifying the blood.
So you can use this for like urethral colitis as well?
Yeah, I will always say that you must see a TCM herbalist because there are multiple causes and there are also internal patterns so for example, this formula raises up, so you have to be careful with high blood pressure, for example.
So this could raise that?
Could increase blood pressure. And that's why they were trying to use it in that last case that we looked at, was because she had really low blood pressure, so they were trying to raise chi up in the body, for example. All right. So I would like to, do you want to do one more case study before you guys go? Yeah? You're the only one who said no, so hey, whatever you got to do here. Let's do one more case study and then we'll finish up. I just have to figure out which one. So you want to do a hemorrhoids one or acne one? Acne? Oh wait, I have to check the page. It's page 34. Okay. Recurrent facial acne over the previous three years that did not respond to antibiotics and became aggravated in the last 2 months. Also had dry mouth and constipation. Showed scattered pinhead millet-sized red follicular papules on the face with oily skin. So based on that, what I told you, what do you think? Which of the 3 patterns is most probable? Because I said oily skin, we probably think damp heat. Check the tongue. Red tongue with a thin yellow coating, meh, okay. Rapid and wiry, meh, okay. So why is it, right, that this is wind heat and not damp heat?
Yellow
It's
is
no
heat.
greasy tongue.
The yellow is heat. It's not greasy, but it's yellow.
Yes? So there's a lack of dampness, signs and symptoms in general. So we don't see the slippery pulse, we don't see a greasy tongue coating, right, which would all indicate dampness. We also don't, even though they say oily skin, they are describing it, millet-sized red follicular papules. So this is actually not like larger, greasy, cystic. So, you know, again, maybe this is an example of this kind of something that actually throws you off. Look at the whole case to try to decide, all right, which one would be most appropriate, all right? The other thing that strikes me here is specifically the dry mouth and constipation. That was my first thought when I got that far, was, oh, this is wind heat. You know, this is the, you know, okay, there's heat, main thing, we need to clear heat. Yeah. And then I got down, of course, and I read oily skin. I'm like, oh, okay, all right, maybe this is damp heat. So look at the tongue and the pulse, go back, assess the entire picture, and check. All right, one more.
It is 3 years.
But recurrent recently. So, you know, last 2 months has been aggravated. Tricky, right?
And there is the constipation. Show me just one symptom that it is long.
Lung and large intestine. Constipation would not be usually common with damp heat.
Yeah. But then I think that it is heat in the lung. Why is it long? If it is heat in the lung channel.
Okay, so what I'm, see if they give any explanation here, but it doesn't seem like they give. They don't give too much of a explanation, but my perspective is this. First of all, look at the formula. If you look at the formula, it does still clear from the inside. It's not saying that there's no heat inside. Lung and large intestine have a relationship, all right? Damp heat in the spleen and stomach should have digestive spleen and stomach symptoms. What, you know, in the pattern differentiation, that is the major differentiating factor, because when you treat damp heat in the spleen and stomach, you're actually addressing this part of the body a lot more. So even though if you objectively look and think you're, you know, from a very broad perspective, TCM patterns, you say, yeah, this looks more like heat in the yang ming, right? Stomach, large intestine heat, right?
Yeah,
the 3 options, because the 3 options that we talked about actually from this textbook the three options for differential diagnosis are this, this, and this. So you're saying, is this damp heat in the spleen and stomach, or is this wind heat in the lung? Which one is more appropriate? The small papules with millet size, that's another key factor. Okay, let's do the one more just for a more confusing. Yeah, let's get more confused, of course. All right. Again, millet-sized red papules since 14. So again, not short-term. Area between the eyebrows and zygomatic region of the corners of the mouth. So this region, not on the forehead. They did not respond to anything. They would appear, disappear, reappear. Also had itching, dry mouth, and constipation. Okay. Yeah. Going through, tongue is red with a thin, slightly yellow coating, and the pulse is slippery. Man, tricky. Tricky. Yeah. Right? And the pulse is slippery here. But again, there's no there's no internal damp heat. All right? There's again the same like kind of pure heat symptoms systemically, right? So again, I asked the question: are there any symptoms of stomach and spleen?
There is none, because it's among the
The pustules are pretty much always present in acne as a disease. Yeah, so slippery pulse is the only sign and symptom here. Yeah, the only sign and symptom. So just like the last one, it's superficial, even though it's chronic.
Slippery is because of the long-term problem of the acne. It's a chronic thing.
And would you also?
The other thing is that, what I would say is that, haven't you guys been practicing in clinic now, right? I mean, you're grandparented members, so you're practicing. Don't you see this all the time with real patients where you say, oh, well, they have mostly, but then they have this, right? Why is their pulse slippery, right? So real patients are a lot like this, and the slippery pulse may be related to, I don't know, this is Miss John, 20-year-old female, maybe she's menstruating. Maybe it's lunch. Maybe she had, ice cream.
Yeah, could be burgers and fries.
Yeah, that's right. We don't know. At any rate, with the case studies, next week we'll spend the whole time doing this. I'm not really sure, but I think that's.
You said that we were going to go through a differentiation pattern thing. You said that
the 8 principles.
Yes.
We can do that. I'm ready to go home. I don't know about you, but we can do that.
Maybe
Next time?
Saturday?
Yeah, we can do that. Sure.
Yeah.
Yeah, so, in case studies, I don't know how to better explain it than look at it almost like litigating, right? Okay, well, this pattern has this much evidence, and this pattern has this much evidence, when you're trying to choose between patterns. And then there's power, and there's an important ability in TCM to be able to connect patterns. When we talked about the spleen and blood relationship earlier today, right? When you have both patterns, you don't, sometimes there's a reason you have 2 patterns and there's a relationship between them. So, yeah, we can go through 8 principles maybe next week to start off, and then, plan on having this, right? So my understanding is you'll have multiple cases from different sources. I mean, I have oodles and oodles of cases, reading case, I use Matfiocha's book for teaching a lot. What is it? Here, the Practice of Chinese Medicine. I use this a lot for teaching and case studies because it's Matfiocha, so the terminology is pretty familiar with most Western, exams. And it's good practice. You know, you can't go through them too much. Even when I go through them to teach, it's like, oh yeah, okay, I see, you know, I learn a new perspective or something like that.
With that last one, why wouldn't you, if you focused on the large intestine, is it because the large intestine is a lot impaired? If you had large intestine dry heat or something like that, that sort of.
Well, so I heard you guys debating or discussing why we need an illness, and actually that's kind of how TCM is always described, even in the Huangdi I Ching, right? Mm-hmm. We say B syndrome, painful obstruction due to wind damp. That is an illness and pattern differentiation, right? And so it's a really roundabout way of answering your question, which is, I think that you have to be careful of so what I see in TCM practitioners, and I've taught quite a number of PLAR groups, talking last year as well as a lot of students, and we get students that are already doctors in China sometimes coming in, doing the program, and you have to have a very clear and definite. You can't have some kind of loose esoteric affiliation with the large intestine connects with the lung, which connects to the skin, therefore I'm treating the large intestine. Right? Can you really explain that to me, that justified treatment, right? That justified the method of treatment. So I'll also put this out. Remember that legislation of a profession, CTCM PAO, and the PLAR process is based on liability and the public safety. Yeah. So there's two parts of this. Public safety is one, but liability is the foundation of that. And so we don't have nearly the same amount as they would in the States, for example, but put yourself in a situation where a patient comes for, 50 treatments and they still have acne. You have to go into a court against me and defend your treatment based on their objective signs and symptoms that you recorded down. So this is the framework that you're coming from with the knowledge base in TCM. You really have to justify it, and you have to be able to justify it with other professionals, which are people like myself or whoever, people that are more skilled than me for sure, right? So that's the rationale or the logic behind it. It should be solid, and generally in TCM, I would base it on a text, which all this is, like all of what we've done so far. The green books, the green kind of Shanghai, it's the one, they're listed on the Pan-Canadian book list. So most of these diseases and pattern differentiations are derived from that. And that justifies it. Well, I looked up acne, and that it was closest to this pattern as opposed to this pattern. Therefore, I treated with this, proven protocol. Okay, they did their professional duty. Or you're using a clinical trial or something. You're using another form of it. This is the loose perspective.
Thank you very much.
Enjoy the rest of your evening, guys. Thank you.